Good afternoon, everyone. Imagine accessing healthcare without taking a day off to visit a doctor. That's the service of telemedicine and remote patient monitoring, a rapidly growing field that's reshaping healthcare. Today, we're going to discuss the market analysis of these innovative services in the healthcare sector. As part of the team, we have Namra Usen, Evander Tan, and me, Shannon Kian, in collaboration to go through each section of the presentation and respond to your questions on telemedicine innovation. The global health scenario in developing nations encounters a shortage of healthcare professionals, elevated medical expenses, and the administration of medical information systems. When the COVID 19 pandemic started, inventive solutions such as telemedicine emerged to tackle these challenges and enhance healthcare accessibility. Our analysis reveals issues in ensuring equitable digital healthcare access. Key problems include resource scarcity and language barrier. Evaluating telemedicine's quality of care requires a focus on conduct, performance, and cultural competence. This approach has gained traction on a global scale in regions with limited healthcare resources. We want to make it easy for people to connect with healthcare professionals and have consultation from home. In particular, we want to help areas that don't have much access to regular healthcare, and telemedicine is here to change how healthcare works all over the world. It makes it simple for patients to get services and allows health monitoring from a distance. Our goal is to tackle difficulties understanding the advantages of telemedicine for both patients and healthcare providers, and consistently enhancing the level of care through assessment and regular review. The integration of technology such as AI, AR, and ambient sensors to customize patient care according to individual requirements with the goal of improving patient contentment and emphasizing inclusivity in terms of cultural and language.
Welcome to our exploration of the integration of telemedicine and remote patient monitoring service. We are witnessing a significant transformation toward digital healthcare, with the telemedicine market projected to go to 450 billion by 2032. This expansion includes over 280 healthcare companies, with leaders like Teladoc Health leading the way. Digital and advanced technology like AI and high-tech wearable devices are reshaping healthcare delivery, offering innovative care methods directly to patients. However, this growth also brings challenge in accessibility and equity, especially in countryside and underserved communities, underscoring the need for inclusive health solutions. The market is experiencing rapid transformation, driven by competitive dynamics and technological innovation. Key players are reshaping the landscape. The integration of AI in electronic health record is revolutionizing healthcare, enabling personalized and efficient patient care. This shift to digital healthcare models brings challenge in training and equipping healthcare providers to use this technology efficiently. Challenge in telemedicine is ensuring equitable access, especially in countryside and underserved areas. Barriers like limited internet connectivity and incompetent technological infrastructure limit telemedicine's reach. This challenge requires strategic investment in infrastructure and policymakers to promote equitable access and overcome the digital divide. Cultural competency is essential in telemedicine for effective patient-provider communication. Challenges include language barrier and cultural difference. Telemedicine platforms are evolving to include multilingual support and culturally sensitive service. Healthcare organizations must focus on enhancing cultural competency to ensure inclusive and effective healthcare for diverse populations. The integration of telemedicine and RPM is revolutionizing healthcare, significantly impacting healthcare providers. The adoption of technology like AI wearable devices and enhancing EHRs is streaming healthcare delivery. This transformation requires healthcare providers to adapt to a new digital method, focusing on maintaining personal care in virtual setting. Addressing this challenge is essential for effective implementation and realizing the full benefit of these services. Thank you.
Here I would discuss recommended strategy or changes, but first let's talk about barriers and challenges that would be faced when integrating telehealth, which are limited broadband infrastructures in rural areas and underserved areas, and therefore patients do not have internet. Also, there are concerns when it comes to privacy and data security, as all patient data, such as monitoring data and history, will be hosted online, causing threats such as hackers to gain access. Another challenge is that telehealth integration may not be streamlined due to lack of structure, causing confusion to patients, healthcare providers, and hospitals. Lastly, some stakeholders may not be inclined to integrate due to complications, lack of trainings, and unseen benefits. Let's look at the recommended strategies or changes. It is essential to provide broadband infrastructure to underserved areas. This can be done through investments such as providing technology devices, opening an internet cafe, and most importantly, collaborating with internet companies such as Verizon or AT&T. Secondly, investing in advanced cybersecurity will satisfy the concern for privacy and data security. Additionally, standards, policies, and structures must be put in place for seamless integration and an ongoing streamlined process, decreasing the margin of error. This includes licensing for healthcare professionals and creating policies that work across state borders, as each state may have different regulations. Lastly, by using incentives, stakeholders will be more inclined to integrate telehealth, such as providing financial reimbursements, incentives, long term cost savings for hospitals through preventive care when remote monitoring, and increasing patients due to convenience and more. Finally, stakeholder and investments. Each stakeholder has actionable next steps. The government must invest in the R&D of developing innovation technology. Hospitals must invest in providing healthcare providers the right skill set and trainings on the technology used to monitor patients remotely and other telehealth technologies. Technology companies should invest in R&D of user-friendly platforms for both healthcare providers and patients to create a seamless experience. And insurance companies should develop policies that provide coverage when it comes to telemedicine. Now let's look at the framework cultural competencies when recommending strategy and changes. The barriers and challenges include diverse patients who may not have the trainings or understanding to utilize the technology. They also may not have the trust in healthcare professional monitoring them remotely due to lack of diversity in telehealth. Healthcare providers may also have issues accessing certain languages since telehealth can be used in different diverse communities around America. Lastly, diverse patients may be resistant to change due to these factors and refuse to utilize telehealth altogether. The recommended strategies or changes in cultural competencies include giving cultural trainings to healthcare professionals to better understand their patients and patient symptoms. For example, certain diverse groups are more prone to high blood pressure or heart attacks due to cultural food they eat and genetics. Promoting workforce diversity in telehealth will attract diverse groups and build trust. Also, community engagement in diverse areas, both in person and virtually, can help patients feel more comfortable with telehealth. Lastly, investing in platforms that are culturally sensitive, such as adding different languages to a platform, is helpful. Stakeholders and investments. Technology companies should invest in training sessions for both patients and healthcare workers to utilize their technology. Healthcare workers must invest time into cultural trainings to learn about diverse groups. The government can support by investing in research and development of healthcare issues that are carried out by different diverse groups, allowing doctors and hospitals to use preventive care to treat patients. Lastly, insurance providers should create insurance policies around cultural competencies such as patient utilizing multiple doctors for language or cultural purposes, as opposed to charging patients extra for speaking to different doctors.
The integration of telemedicine and remote patient monitoring represent a significant transformation in global healthcare, especially after COVID-19. The rapid market growth, driven by technological innovation, necessitated a careful balance between integration and addressing challenges. Healthcare providers must adapt, emphasizing cultural sensitivity. A comprehensive approach involving government, healthcare providers, technology companies, and insurers is very important. Policy recommendations include financial incentive, regulatory frameworks, broadband investment, and cultural competency training to ensure technological advance, accessible, equitable, and cultural sensitivity telemedicine services.